Victorian Healthcare Association, or VHA, and the Victorian Alcohol and Drug Association, VAADA, to support integrated practice and good governance across our 3 sectors. This initiative is very exciting, and I might add has been incredibly successful during COVID. So we've had many hundreds of people through a range of webinars over the last 12 months. And I'd like to acknowledge my 2 colleagues, my 2 CEO colleagues in each of those organisations for the formal and very deep collaboration that we have across 3 quite varied but connected sectors. Now you can see up on this slide, we always like to do housekeeping, because if you're like me, you'll unfortunately sometimes remain unmuted and people can hear you tapping away on the keyboard. But today's webinar is being recorded. So, you know, if you have to drop off of this early, don't worry, we'll be able to make sure that you get a recording. The recording and presentations will be shared with you after the webinar and available on the website and the TriPeaks part of our website. And if you have any questions, please write it in the chat or the Q&A feature, and you'll find those, particularly the Q&A feature and chat function, at the bottom of your toolbar. So we will do our very best to make sure that there's plenty of time for questions, and where we can answer them we will, and we try to endeavour, in the event that we don't get to them during the session, to ask them of our panellists and get back to you. So without further ado, so that we have plenty of time to take in this fantastic information we're going to get today, I'm going to now introduce you to our speakers who are going to speak on the voice of the client framework. Now, for many of you, I'm certainly at the centre, this is something that we are always considering, how we can make sure the people that we work with are engaged and integrated into our everyday work. But today we have Sarah Bendall, the Director of the Community Services Quality and Safety Office at the Department of Families, Fairness and Housing. Sarah is a qualified lawyer and Company Secretary with almost 20 years experience working to promote client voice in the access to justice and human rights sector. Her focus is on empowering people to speak on their own behalf within the systems and processes that affect their lives. Sarah will be presenting with Matthew Zammit. Matthew Zammit is a management systems auditor at SAI Global, responsible for technical reviews and NDIS clinical governance audits of providers registered under the National Disability Insurance Scheme. He's also a registered nurse like myself, and has personal lived experience of disability. His emphasis is conducting audits of the NDIS providers to seek as much feedback from participants and their families as possible, in order to empower their voice and ensure that providers have systems in place to seek and utilise the input of the NDIS participants in their own governance and operational frameworks. Matthew worked as a consultant at all stages of the client voice framework for community services in order to ensure that it captured the lived experience of service users from our communities. Sarah and Matthew will be joined by Neela Konara from DPV Health and Kani Motiani from Barwon Child Youth and Families. Kani Motiani is the facilitator of the Youth Advisory Group for Communities That Care in Geelong. She has worked in this role at Barwon Child Youth and Family Services since 2018, alongside supporting and facilitating other family and parenting programs within the organisation. Through the Youth Advisory Group, Kahani connects with young people from various Geelong secondary schools through fortnightly meetings and exciting community projects. Kahani is passionate about creating a space where young people can feel part of something bigger than themselves, and she loves to bring plenty of creativity to this project as it continually evolves. Neela Konara is the Manager of Population Health and Community Engagement Platforms at DPV Health. Neela has several years of experience working in community health, local government and primary prevention. Neela is passionate about improving community outcomes through systems change, focusing on equity and equality of services and community engagement. And just so people don't know, DPV Health is Dianella and Plenty Valley Community Health, for those that don't know the acronym. So without further ado, enough from me. I think you're going to find this really, really valuable session. I'm going to hand over to Sarah, who's going to take it from here.
Thanks so much, Deb. We might just shoot back to the other slide if that's okay. I might also begin by acknowledging the traditional custodians of the lands on which we meet and pay my respects to elders past, present and emerging. Thank you so much to the Tri-Peaks for the opportunity to talk to you today about the Client Voice Framework. And thank you also to Deb for that introduction. It is really wonderful to be with you all today and to see so many of you. And thanks for joining us and for recognising that embedding the client voice into our work is essential for the delivery and the design of safe and high quality services. So Deb has already introduced us all. So I might just, before we run out of time at the end, give my own heartfelt thanks to Matthew, Neela and Kahani for sharing their time and their expertise with us today. It is greatly appreciated, and it really is through experiences like this that we can all learn together about how to embed the client voice well within all of our work. So I'm just going to briefly outline what you can expect from the session before we dive right in. We are going to talk about the client voice, obviously, and what it is and why it matters. We're also going to talk about what it's got to do with quality governance. We're going to talk about the client voice framework that the department developed in 2019, why it was developed, and most importantly, how it can be used. Where, as Deb said, I'm going to be facilitating the session with Matthew. And in the second part of the session, we're going to hear from Neela and Kahani with their examples of how they have used the client voice framework to ensure that client voices are embedded in their daily work. So there will be plenty of time for questions at the end, but please, as Deb said, pop them through the chat and even share your own experiences about embedding client voice in your work. We'd love to hear about those good news stories as well. Next slide, please. So before we get into the client voice framework, I wanted to spend a couple of minutes talking about the Community Services Quality Governance Framework, because the Quality Governance Framework is the umbrella framework under which the Client Voice Framework sits. As many of you will know, the Client Voice Framework sets the vision for achieving safe, effective, connected and person-centred community services for everybody, every time. The framework identifies 5 areas of focus or domains, which you can see on the right of this slide, to achieve that vision. And those domains are underpinned by continuous monitoring, evaluation and improvement, which you can see encircles the quality governance flower there. So the quality governance framework actually aligns with the Victorian health sector clinical governance framework, because we recognise that most of you actually work in both sectors. So from your perspective and from your clients' perspectives, these frameworks do need to align. Today, we're going to be talking about the top petal, if you like, the light blue petal, which is the client and family partnerships domain. And this domain recognises the importance of partnerships for improving outcomes and the client experience. Under the client and family partnerships domain, it is a priority to promote the status, presence and influence of client voice in all aspects of community service design, delivery and review. So the objective of this domain is to improve the quality and safety of community services by making sure that the client voice is always included. Next slide, please. So this leads us to the client voice and the client voice framework. This graphic was created when we launched the framework back in November 2019. And it's a really terrific graphic because it outlines in clear language what the client voice framework is all about. In particular, it outlines, and I'm not sure if you can see actually, because on my screen, my face and the face of other people is actually blocking the client voice principles on the right. But the slide you'll see when they're provided later out of session outlines in clear language the principles that I'll talk to in a minute. It also outlines some of the key messages that you'll see in the framework, which is one of my favourites, is that it's not possible to deliver safe quality services without listening to the client voice. And importantly, from our clients' perspectives, that clients need to be able to see that their contribution is being taken seriously and that their input is making an impact. And everyone must seek, listen to, and act on the client voice. So the client voice framework provides an overarching frame based on the 5 principles that we'll go through in a second, which guide people at all levels of the system to seek, listen to, and act on the client voice. The framework emphasizes the critical link between quality governance, client voice, and outcomes. The client voice itself was written with the help and input of clients, direct workers, policymakers, and staff from across community services, including Matthew. It is also consistent with the Aboriginal self-determination as described in Korin Korin Balanjak, which is the Victorian Aboriginal Health and Wellbeing Safety Strategic Plan from 2017 to 2027. And you'll see, potentially not in these slides, but you will see when you read the client voice framework that Aboriginal self-determination and cultural safety are embedded in the principles and what we've identified as the principles in action. Another element of the client voice framework is that it provides some key considerations for people to consider when thinking about how to embed client voice into their work, such as the different levels of participation, recognition, payment and reimbursement, power imbalances and how to be mindful of that, and other ethical considerations. At its heart, the client voice framework is a capacity building resource. It aims to consolidate what we all instinctively already know, value, and in many cases already do, rather than try and recreate new requirements. Next slide, please. Thank you. So I've included this slide here because it gives you a visual of the type of information that you'll see in the client voice framework. It is a lot to take in by slide and I won't go through it all, but you can see here the 5 principles of the client voice framework that I was talking about before. The way that they're described, importantly, is also reframed in terms of how clients would experience those principles. So, for example, the first one there, the client voice is essential for quality and safety. From a client perspective, that would be, I experience safe services and I can speak up if something isn't right. Clients have expertise, we'll talk about in the next slide, so I'll skip over that one. Client voice is a part of everyone's role. So from a client perspective, I receive help and support in a coordinated way at the right time. There are many client voices. From a client perspective, I receive help and support in a way that makes sense to me. I choose how much I participate in services I receive. And the 5th principle, the client voice leads to action, which I think is the most important one. From a client perspective, I can influence change. On the right side of this slide, what you'll find in the client voice framework is what the principles look like in action. Again, I won't go through them all, but if we move to the next slide, we're going to focus on clients have expertise, which will give you a more detailed look at what the principles look like in action. Next slide, please. Thank you. So principle 2, clients have expertise. What you'll see in the framework is the principle outlined, and as I said before, what this looks like in practice. So clients have expertise looks like clients are recognised and treated as experts in their own lives and experiences. Client views and experiences are actively sought after, valued and acted upon throughout all stages of their involvement with the service. Or organisations can show their commitment to self-determination for Aboriginal and Torres Strait Islander people. So the framework then goes one step further and provides examples of the principles in action at an individual, organisational and systems level. And you can see a couple of examples of those for the 2nd principle down the bottom of this slide. So from an individual level, what this principle looks like is staff actively seeking out genuine partnerships to enable shared decision-making. From an organisational perspective, job roles for people with lived experience or client positions on boards and committees of management. And from a system perspective, it might look like policies on client payment and recognition. Just to the right of this slide, I think you might be able to see a couple of them, or maybe all from your screen, is my favourite part of the client voice framework, which is the inclusion of tips from clients. And the two that I can see there that I'll just read out is client tips for this principle is don't just tick the boxes, listen and respect. And the other one being that children are rarely asked what they think. So the framework, in summary, offers a way for organisations to assess how they are going, as well as to plan for change. And so if you are early on in your journey of embedding the client voice into your work, one thing that's quite good to do is to sit down in your team or in your broader organisational structure and include clients as well, and reflect using the principles and what they look like in practice on how your services are going. And from there to identify any areas that you might be able to improve and to develop a plan for action. Next slide, please. So we're going to spend just a couple of minutes now talking about what the client voice actually is. This definition that you can see at the top there is very broad, and it was built from the insights of staff, leaders, and people with lived experience as we developed the client voice framework. So the definition is that the client voice refers to any and all expressions of views, opinions, needs, experiences, and outcomes of individuals, families, and carers who have previous or current involvement with community services. You'll also see there that there's some examples of information derived from clients, which I won't read it all, but I'll leave that there for you to read for yourselves. But just drawing out a few, it's an interaction with the worker, case planning discussions and records, complaints and feedback mechanisms, quality audits, to name just a few. And as I said before, the client voice, as I'm sure everyone already knows, is relevant at all stages of a person's involvement with the system, at all levels, individual, organisational, and system. Next slide, please. So before we play this video, we have a short video here on the client voice. I'll just note that after the video, I'm going to hand straight over to Matthew, who's going to talk in a bit more detail about his reflections on the connection between client voice, quality, and safety. And he's also going to give us his personal and professional motivations for engaging with the Community Services Quality and Safety Office on the development of the client voice framework. So if we could just watch this short video now, thank you.
It is really important to be able to have the voice of the people using services, so then they can be tailored towards what they actually need.
So that we're having input into services that have an impact on our lives.
A long time ago, a saying was coined, which was nothing about us without us. Being involved in the way the services are planned and delivered means that you end up getting something that actually suits you.
By understanding the lived experience, you can best apply policy and programs for people who receive those services.
It's absolutely fundamental to how we take a much stronger client user perspective in the way that we design and deliver services and supports for people that use them.
The client voice is the experience and perspectives of people who are actually using a service.
The feedback provided by participants or people who receive services.
The client expressing their wishes, their feelings, their wants, having an opportunity to be empowered.
It could be on policy issues, it could be on service delivery issues.
to have a say in how they're designed and implemented.
They have the right to have their voice heard.
To see what worked, what didn't work, and where improvements could be made.
It feels like that we are not important and we've got no control over our lives.
You feel like you don't matter, but also you feel like perhaps you shouldn't have mentioned anything.
Continually having to ask someone to just listen to me can be really deflating.
I feel frustrated because with someone with an intellectual disability, we're normally the ones who get left out. Just because we have a disability doesn't mean we don't have smart ideas.
On the other side, when our voices are heard, we feel empowered, we feel like we're working on a win-win situation.
To know that someone is saying, I get you, I hear you, I understand what it's like to be you. I think there's nothing more powerful.
There's a fair amount of excitement across our workforce for how we take a much more user-centred approach in terms of the work that we do.
It's about that genuine listening to the client and what they have to say rather than that faux consultation process. Why change? Because there's been failings in the past.
Often I find that services that I go to or I'm a part of don't want feedback because it means change, or it means that people are being critical and they don't like that. The lesson there is that that can provide area for improvement that they can work with.
So if we're not listening, we're not going to be solving problems.
I think the onus is on all of us to take that responsibility seriously and to incorporate the voice of our clients in everything we do.
Over to you, Matthew.
Thanks very much, Sarah. And that was a great video, and I can see I've lost a bit of weight since then, so that's great as well. Hi everybody, my name is Matthew, and looking at the graphic that's on the screen now brings back really good memories. That was made through consultation. That was actually something that was new to me, that had been put forward by somebody from the department that worked on this as an idea, and it was to, when we had these consultation sessions with clients and people from some in the city, and we went up to Wangaratta and spoke to people from a regional area as well. Rather than jot down ideas and write it all down in text, we actually had an artist put it together like this, and obviously some of it is in text, but it all came together into the number of the graphics that you're seeing, and I thought it was fantastic, and so did the people we were speaking to at the end, to see that their ideas had been encapsulated in such a way that really spoke to people, rather than just slabs of text in a black and white sort of format. And so, as I said, we spoke to, I would say, a few dozen people in putting together the client voice framework. And one of the important things to consider, when you are including the client voice into whatever you do, is to include them from the very start. How do you want to be heard? How do you want to have your say? Because, you'll find that some people, want to be very involved. Some don't really want to be involved, and that's their choice. But offering that choice from the start, and, allowing the different levels of involvement as per individual choice, is a really important part of the process, that you don't just say, here's how we're going to listen to you, here's how we're going to let you have your say, fill out this form or fill out this survey, which may very well work for some people, but others it may not work, and they might want a different way of giving that feedback. So I thought it was really good that in putting together the client voice framework, the first questions we asked people were, well, you know, what's happened in the past? How have you felt that you've been heard or not heard? What's worked and hasn't worked in the past? And what do you want it to look like in the future? What involvement do you want? And what do you want as in terms of a response to that feedback that you give? And for me, it's, you know, it's a bit personal as well. I've you know, had a nasty road trauma event, as I will put it, around 10 years ago that, well, I had acquired disabilities from that, including an acquired brain injury, and I spent about 6 months in inpatient rehab at an acquired brain injury centre. And look, it was good in many ways, but in many ways also it was, I thought, not a very empowering place. And fortunately, they've changed the way they do things. And I actually had some input into that, which was fantastic. And it came about from speaking up and encouraging some others to speak up as well. And it's always good to see that, you know, like somebody in the video said, that, you know, when you are giving feedback, that you're not just being heard, but action is being taken, or that you get that closing of the loop of, well, look, here's what we're going to do about it. Here's what we'll consider about what you've said. And it might not always be that, you know, somebody's suggestion or opinions what an organisation runs with at the end of the day, but you know, that's democracy. But at least knowing that they were considered, and that if something, you know, couldn't be done to somebody's suggestion, that you know, that there would be a maybe a compromise, or that there would be a reason that somebody else could you know, comment on as well. And some of the good frameworks that I've seen in NDIS providers, which are, and I've seen many of them in my role doing audits of quality and safety audits of NDIS providers. You see quite a number of ways that the client voice is incorporated into those providers, and it's a necessary part of NDIS service provision. It's a requirement under the NDIS practice standards, but many have been doing this long before the NDIS. And it can be anything from having advisory groups or having some even on their board. Some of the larger organisations, they've got a board and they've got 1 or 2 places for either clients or their family members to sit on that board, and they rotate every year. And some have got just ongoing feedback sessions with senior management, where senior management go around to all their sites and have in-person feedback sessions with participants, and you know, use that to shape the service. So it's you know, it's an absolutely critical part of service provision, that you are listening to the client voice very actively, and that you're shaping services constantly as part of that continual improvement process by taking into account the client voice, because that's what the service is there for, right? So you know, it would, I'm sure everybody delivering a service would want it to be relevant and as useful and as, you know, safe and as of a high quality for the person who's going to be using the service. So I'm really excited to be, you know, it's been really exciting seeing the client voice framework come this far from the, you know, from its nascent days some years ago. And so it's going to be really exciting to see services start to use the framework. And I'm sure, no doubt, in using the framework, the framework itself will no doubt be changed and shaped by the way that it works in practice. But that's that's great. That's part of the continual improvement process that we should see along all stages of all organisations.
Thank you so much, Matthew, for your insights and your expertise. It's just fantastic hearing about your experiences and how you, as a client of services, have used your own experiences to improve service delivery. Thank you. We're now going to move to the practical session of our presentation, and we're going to hear first from Kahani from Barwon Child, Youth and Family, and then we're going to hear from Nila. And there'll be, as I said before, lots of opportunity to ask questions. So Kahani, I might throw over to you. Thank you.
No worries. Hi, everyone. As Deb mentioned, my name is Kahani and I work for Barwon Child, Youth and Family. And I'm the facilitator of the Youth Advisory Group for Communities That Care Geelong. Just to begin with, because I know a lot of people aren't quite familiar with Communities That Care. I know I wasn't until I joined BCYF. Communities That Care is a community approach with various CTC sites across Australia and even internationally. And it aims to promote the healthy development of children and young people and prevent health and social problems through long-term community planning. So for CTC Geelong, our northern suburbs of Geelong are our catchment area. So we have quite a focus on programs and services in that area predominantly. And the youth advisory group that I facilitate is essentially the youth arm for CTC Geelong, and it was set up in August of 2018. So initially, CTC Geelong was established as a steering committee of agencies, professionals and community members, but of course it dawned on the committee that in order for CTC Geelong to be truly representative and for the services and programs and on its action plan to be informed by the voice of the young people that those programs and services were designed to benefit, a youth arm really did need to be added. And so our group started back in 2018 with monthly meetings, just with 2 students at the very beginning, after school on a Monday for 2 hours at a central venue in Geelong. And from those 2 students at that first meeting, very slowly, very gradually, our group has grown. 2.5 years on, at our peak, we've had 15 students from 5 different schools involved in the group. And the numbers are continually shifting as some students take on new commitments and we lose other students but gain new ones. But I'm really proud of how the group has evolved over time and essentially what the group has done through that journey so far. It's probably important to mention that our young people in the youth advisory group are not clients of BCYF as such. They're participants whose experiences and opinions of the local systems and services related to the 3 specific priority areas of CTC Geelong are the experiences and opinions that we really want to, and really need to hear and listen to. So those specific priority areas for CTC Geelong are reducing early age alcohol use, strengthening family connections, and improving school engagement and completion. So in this way, the Youth Advisory Group operates within the client voice framework that Sarah and Matthew have described in very much the same way, even though they participate in the Youth Advisory Group voluntarily as an extracurricular activity. So I'll just get you to go to the next slide, please. Perfect. So you'll see there on my second dot point, the Youth Advisory Group gives young people a voice via consultations. So they've had many opportunities to provide feedback on programs and services both within BCYF and beyond. So an example within BCYF might be the Just Think program that is run, an alcohol awareness program run for secondary school students in conjunction with the Geelong Cats Football Club. And so our Youth Advisory Group students have had the opportunity to have some open discussions about that program since they participated in it. And those bits of feedback have extended the feedback that's been gained by students completing a little feedback form at the end of a program to give a little bit more in-depth understanding of what the students experience and some rooms potentially for improvement. And that obviously has been passed back to the program's coordinator and facilitators. And then outside of BCYF and even outside of Geelong, the students have had the opportunity to be consulted and participate Particularly last year, the Commission for Children and Young People reached out to us and said, would your students like to be part of a Zoom consultation about the impact of COVID-19 on young people? And those insights, along with lots of other consultations that happened across the state, were put into a series of summaries on topics of education and mental health. So really exciting, hands-on, real-life opportunities for our group to have a say. And then I guess one of the really exciting parts for me about this group are the projects in the community that they've had the chance to actually do and create, apart from sitting around and having discussions, which are super important, but also these students in the group have said, let's do something. Let's go out there as well and do something a bit active. So a live event for families of adolescents was one of the first projects we did. It was called Positive Choices back in 2019, and it was a free family event that touched on adolescent alcohol use, cyberbullying, mental health. It had interactive activities, a guest speaker, of course, finger food and show bags, and the students were really active in putting that together, and it was a big success with around 30 people involved all up, including attendees and organisers. There was a short documentary they made on school engagement, so that was filming lots of interviews with teachers and students and parents. Last year, during the COVID lockdowns, the students put together a live trivia event series as a way of bringing together families and really promoting family connectedness, which was fantastic. A Messages of Hope initiative was one of the projects they did last year, putting together some really uplifting messages and quotes on very crafty little cards, and then distributing those cards into the community, whether it was in a local cafe or just dropping in some local neighbourhood letterboxes. And last thing there is a podcast series that the students are currently working on. That's our work in progress project, and that'll be around preventing mental health problems among young people, which they've identified to be something that the current students involved in the group feel really passionate about, especially on the back end of last year's really tricky time. So I've just finished off that slide there talking about mentoring, teamwork and personal and professional development within the group. So it's really important to me that we're giving something back to these students. They're giving so much to us and to the CTC Geelong Steering Committee through their contributions and discussions and projects. So in return, I write them reference letters if the students have been involved in several meetings, so that if they're getting to the point of wanting to find a part-time job, they've got a little bit of something there that vouches for how wonderful they've been as valuable YAG members. And workshops and trainings, I've put together a few little mini workshops within our existing face-to-face meetings. So we've done some cover letter and CV writing, time management skill workshop, memory skills workshops and public speaking skills, again, all bouncing off what they've told me they would like to learn more about and they'd like to extend their knowledge of, or perhaps things that they're not actively getting from the school curriculum or from other extracurricular activities. So we're back to meeting face-to-face as a group after a whole year of meeting only on Zoom, and I think I'll finish on the point of the most interesting observation for me in the Youth Advisory Group journey so far, which was the students' eagerness to continue meeting through last year, even though it had to be online rather than in person. And not just that, but to increase beyond our monthly meetings to actually meeting on a weekly basis, which was purely their desire and which I wrangled availability-wise. So once for 1 hour every Monday, we met throughout the entire of last year. And for me, that really showed that the students really value the Youth Advisory Group. They appreciate having that voice, and it formed something that they could look forward to each week and a way to connect with other students as well. That's it from me.
Thank you, Kahani. It's so fantastic to hear about your initiative. And I just want to hear more and more about the projects you put there in the example section. Matthew and I are going to ask you a few quick questions, and then we're going to move on to Neela, so we have enough time at the end of this for people to ask their questions. Over to you, Matthew.
Kahani, that sounds like an amazing thing. And last year, that must have been such a valuable thing for those young people to have that connection with each other and a connection with something that had been so positive. And I'm sure that the young people bring so much to it themselves. But that said, I guess it also sounds like having the right facilitator of the youth advisory group has been quite critical as well. So could you tell us a little bit about how you've developed that role and what some of the key skills you've needed to learn as you've gone along in that role as facilitator?
Well, it's been really interesting for me. I think when I started, I came to the role with an assumption that students would automatically jump on an opportunity like this, and I think that's because I was thinking about myself at that age, and that it would be really easy to recruit students. And I came to realize actually it can be quite a daunting, especially when advertised just on a flyer. It can be quite daunting for students rocking up to a meeting with other young people that they don't know. It's hard to gauge exactly how formal these meetings will be, how much work might be involved from them. So I think one of the key skills I learned from the get-go was that in order to recruit members and retain members, I had to have a certain level of approachability and relatability. And I had to create an environment where it did feel fun and comfortable. And yeah, so basically rapport building was the biggest skill, and I think remains the most important part of my role as a facilitator. A lot of the students, I think, took a while to kind of work, and still are working out what I am to them in terms of I'm not their teacher, I'm not their parent, I'm not their peer. I'm trying to create an atmosphere where they want to keep coming and it's kind of cruisy and fun, but at the same time, all right, I need everyone to sit down and be quiet now so we can get something done. It's sort of in the middle, it's a bit of a balance. And so I think learning to walk that fine line as a facilitator, I guess as a mentor in some way, has been something that I've, it's been an evolving skill that I've had to kind of learn. The other thing I'd say is flexibility. There's been so many ups and downs with the group, not just because of COVID, but, you know, some students having to leave because they've got new part-time jobs. Sometimes I have an idea I think is fantastic for the group and I put it to the students and they say, oh, no, that doesn't sound so great to us. So going with the flow, I think, is the other main skill that's been crucial to the evolution of the group.
Thanks, Kahani. Another question from me is, how did you bring the group together at the beginning and build rapport with and within the group? Noting, as you said before, that these were young people that didn't necessarily know each other.
Yep. Good question. I think I'm still asking myself that. So to begin with, we just had 2 students from one school. And like I said, I realized it was quite daunting just from a flyer or a notice in a school's newsletter about the opportunity. So I found that the best way to get new students on board was actually to go to the schools and speak at an assembly or speak to a class, because as soon as I was saying, I'm the facilitator, this is the sort of, I guess, the vibe of the meetings and of the group, I think it kind of helped to break some barriers down and create a sense of, okay, this is perhaps not as intense and nerve-wracking as a youth advisory group meeting can at times sound to a young person. So that's kind of how it started. And then a few students, once they've been coming and having positive experiences in the group, really helped to take it a further step in terms of numbers by then promoting it amongst themselves. So word of mouth then from there. And rapport within the group, I think it all came down to some solid icebreaker team building activities within the meetings to get everyone to get to know each other. And sometimes I'd spend a whole half a meeting focusing on those activities and discussions that just were enjoyable and allowed people to get to know each other before we then moved to, all right, let's talk serious things and let's work on a project, because otherwise it was going to feel stiff. So I think that was important as well.
Excellent. Thanks, Kahani. And something else I was going to ask, and I think you touched on some of these before with COVID and part-time jobs and all the other things that come up with young people in their lives. But what are some of the biggest challenges that you and the group have encountered, and how have you worked together to overcome them?
Yep. Yeah, so I did sort of touch on those, but I think recruitment has hands down been the trickiest thing. I think sometimes it's not necessarily out of a lack of eagerness or willingness on a student's part to be involved in this opportunity, but there's, you know, logistics, and they don't have their licenses, so we need a parent to drop them off, or we need to work out a location that suits 4 different schools, you know, students from 4 different schools. So just getting students to be able to come has probably been the trickiest thing, and even just working with schools to make that happen. You know, schools have so much on, or you build up a relationship with a wellbeing worker at a school who loves the idea of the youth advisory group, promotes it to everyone they know, and then that wellbeing worker moves to a different school. So just little challenges like that. But the main thing that I've learned through all of it, and the students have learned it alongside me, has been to persevere. Just keep doing this, keep doing what you're doing, put the word out in every way you can through different methods, different forums, and something will land. Just don't give up.
That's great, Kahati. I like that message. Don't give up. I think it's really what it is all about. There's a couple of questions actually for you in the questions and answer box, and I'll give you a second to have a look at them. But so that we have enough time to hear about Neela's work, I'm going to throw to you, Neela, now. Thank you.
Thank you. We'll get the slide up as well then. So this is really a visual of our thinking around community engagement and client voice platforms to provide inclusive services for the catchment, the very diverse catchment in Hume, Whittlesea local government areas and the areas we work in. Really, we feel that we're at a very start of a journey to have a strategic and a strength-based approach for all this work. What you see in this slide right at the top is the guiding resources and the frameworks that's really shaped our thinking. The next one is the inclusion strategy, which we recently endorsed, focused on those 5 different areas to really guide the work we do at DPD. But today I'll focus on the bottom end of the slide. The local community we work with is very diverse, and that's what you see right at the bottom in green. And we have a number of community platforms as a response to the very diverse communities we work with, reflecting their needs. So the community network is our most recent platform, and it was really developed as a response to the community that we work with, telling us we want to contribute, we want to be part of community, supporting the health and well-being of community, but we are really time poor. So we've established a community network that's online and digital, and any community member can volunteer to be in the network and identify which of the following communities they belong to, and we call on them as we require their support. And various community members bring various skills and knowledge, and they can put their hand up to support when we need support, whether it's service planning or to promote a service to a relevant community. So recently, with our Rainbow Tick accreditation, the community members who identified as LGBTIQ community members put their hand up and helped us with that process. And Community Connectors is really a community leadership program where we train and recruit and support a number of community members. We choose community members from the different diverse groups. Currently, we have about 15 community members from LGBTIQ community, also from the advocate from the disabilities community, and also a number of different ethnic groups where we recruit and make them part of a community leadership training program with a strength-based approach, and support them over 12 months to develop programs with their support. And so it's an empowerment model where we support them to work with us and community members that they bring from their relevant communities to be consulted for our program development, and also to provide inroads to their communities to provide them with timely access to health services. So a lot of our ethnic community members support us to get access to their ethnic media channels and to promote things, but also really been valuable. We're doing a number of resource development for South Asian community around family violence, and we have the opportunity to consult the community members that we've been introduced by the community connectors. Digital community connectors is another really new initiative where we are hoping to recruit a number of community leaders who are in the digital space, whether they administer a social media group in a different language, or have a blog for young people, or various others who we want to work with. So we do the training, the community leadership training program with them and work with them over the coming months. Community reps is our historical group that's been there over the years. Currently, it's a number of seniors that we really value and has been provided us invaluable input. We meet with them on a regular basis, and they get to have a say in any of our service planning, brochures or flyers, or also promote. They really are helpful to promote our services to different communities they belong to. And they're also part of the community connectors since the last couple of months. Community volunteers, we couldn't have done without them, particularly during COVID. We have about 80, 90 community volunteers who have helped us with various community initiatives. We have a phone connect program with volunteers who ring up other isolated community members, and anyone can refer people to that, and our volunteers will ring up. But they also provide us great input and provide their voice in our service planning and delivery. And local partners. We work across a very big catchment, human literacy, and very fast growing and very diverse. Particularly during COVID, we feel that it's the strength that we have strengthened our partnerships. We've connected with over about 65 community organizations on the ground, and they're invaluable in terms of the insight they have about their own communities, but also they're trusted by the communities they work on a day-to-day basis. So we work with them as a network to bring in community voice and also to promote the services so that communities have timely access to services. That's all from me, Sarah.
Neela, you said at the start of your presentation that you were at the beginning of your journey, but I don't believe you, and I don't think anyone else in the webinar is going to believe you either. This is a really fantastic piece of work. Congratulations to you and DPV. I'm going to throw to Matthew to ask you a question.
Yeah, thanks, Sarah, and thanks, Neela. That's an amazing. It's an amazing amount of work that you've done, as Sarah has said. And to think that what DPV was only merged together a couple of years ago, and then since then you've done such an expansive amount of work to amalgamate yourselves as a organisation. And so obviously one thing I was wondering was, could you tell us a little bit about some of the ways that you made sure that the community voice, and it is such a diverse community that you're representing across that catchment, but some of the ways that you made sure that that community voice was captured through the various platforms to inform DPV Health's inclusive service provision?
Sure. So Matthew, we have a way that we get input or the reports from all of these different community platforms coming through to our Community Inclusion Implementation Committee, which is what you see on the slide in the middle in pink. That's a committee of staff who are decision makers, as well as those that will put things into action. And we are really, as I really meant when I said we're at the start of a journey, we are really making sure that the committee understands their role, but it's really important to us the input is considered and actioned in a timely manner. So that's the committee that oversees this function, and we get the process set up is to get reports from all of the platforms as well as from our quality team, our client feedback. So we also consider that, and all of that is fed through to the implementation committee, and then equally to as required to our executive team and to the senior leadership teams, to considering we have a very broad range of services we work with, to make sure that the information we get this informs our actions in place. Other thing to mention is probably the inclusion champions that I mentioned there. Employee inclusion champions are like our eyes and ears staff who have volunteered to be in the committee of these inclusion champions, who keep an eye out for any sort of opportunities where we can improve inclusion, inclusivity for staff as well, workplace, as well as community as well.
Excellent. Thanks very much, Neela. That's I like the idea of the inclusion champions as well. I'll throw over to Sarah for the next question.
I'm actually going to open it up now, noting that it's only a few minutes before 1:30, noting that we have had a go at answering some of the questions that everyone's been popping into the chat, but just opening it up to everyone now, Deb.
Great, thank you, Sarah. Now, look, there were a ton of questions in the Q&A that Sarah and other team members are madly answering, which is fantastic. We will get these answered offline if we don't get them answered during the session. There is a question here about reimbursements, though, from Kate O'Donnell. I'd be interested if we can get some quick reflections from Sarah and or the panel about reimbursements.
It's such a good question, Deb and Kate. Thanks for asking it. It's a really tricky one, and it takes some careful thinking, I think, around exactly the type of client engagement that you're thinking about. We are, and you'll see from this slide that's up there helpfully now, thinking about guidance on reimbursement and recognition as part of the current work that we're doing at the department. I think my very quick answer before opening up to everyone is to think about what is, I think, engage with clients in what you think is fair reimbursement, to think about reimbursement from the perspective of whether you would remunerate, for example, a consultant for similar type of expertise, and to think creatively, like Kahani was saying in her presentation, about other things that you might give to clients who are giving their time, like letters of recognition or training, like Neela was talking about training. There's lots of things that you can do to demonstrate the value of the client voice that you're receiving. Just open it up to everyone.
Any other comments from any other panel members? Or has Sarah covered it? Yes?
Oh, I was just going to add to that, because that was something we always think about in developing the community platforms. I suppose for us, we currently provide incentives in a number of different ways, like Kahani mentioned before. Some people are keen and very grateful for references and all various other ways. I have to say that in terms of our volunteers, all of them have that option, but we also provide, for our community connectors, we provide an incentive because it's quite an intense training session that they have to attend over 8 weeks, and then also support. So we really value not only the community connectors, we do really value the input and the insight they bring into us about their communities. And this is a question that comes to us and we often think about as well. And with the digital community connectors, which is just at the starting planning stage, we are hoping to have that discussion openly with the connectors. How can we, what is the right incentive to make sure that we've got their commitment over 12 months, which is what we're expecting. And we, to the community connectors, we provide them a gift voucher at this stage of $30 for the sessions they've attended and support they provide, which is really, really the inroads they provide to us, the insight they provide to us. From we could never get that as staff, or it would take much more. It will be very much more expensive if we had to do that as staff, to understand the ethnic media that we've got access to, and the community leaders, the faith leaders, and the way they've provided support to us.
Thank you, Neela. Now, I'm going to actually wrap us up because it's 1:29, and what starts to happen is people start to quickly drop off because this is probably their lunch hour, and they've taken their lunch hour and they're listening to your fantastic ideas and influences. There's a couple of things I want to say. For those that have been listening today, please complete our evaluation. It comes up after this, and you can click on there and evaluate this session so that particularly for Sarah and myself, we can work out what we do next, because this is just the beginning of a conversation that we want to have between Sarah and the Centre about client voice. You've heard some brilliant examples from my colleagues about what's actually happening out there, and there are lots of examples of brilliant work that we want to bring to you. So from our point of view, I want to just touch on, we run a program called The Voice of Parents, which is to bring forward parents who've had contact with the child protection system. These are not voices that you hear very often. And a lot of my colleagues today have talked about how you can bring voices forward from communities who who often are hidden. And we know that's a pretty hidden group of people that we want to bring forward. So we're pretty proud of that. You never know, we might present that to you in one of the next sessions. But I want to say thank you to the people that present, the panelists today. You're all fabulous. Lots of fantastic comments in the chat, but also lots of questions. And so what we're going to do is take those offline and get them answered. If we can be so bold to ask my colleagues here today to get those questions answered, and we can get them back to the participants of the webinar that have come along today. Virtual clap to you all. Thank you so much for being here with us today. Thank you so much for making this such an enjoyable hour of our day to take stock about how we can do all of this a lot better. And have a great Easter for those of you that I won't see. Stay safe, look after yourself, because we need you to do that and keep up all the great work. Thank you so much. And thank you for my team who are in the background there, making sure that the technology and all of that works really, really well. Thank you, everybody. Bye for now.
Thank you, Deb. Thank you, everyone.